Well, when it comes to your health, it's easy to put things off, especially if we're not even feeling sick. But you should still feel the need to take care of yourself, self-care, right? Here with some important screenings that should be on every woman's to-do list. Dr. Jennifer Uku with Memorial Hermann Medical Group. It's great to see you, Dr. Uku.
Thank you so much for having me.
Let's first start off with this notion of, okay, I'm feeling great, probably don't need a physical, everything's great, because I think as busy moms, busy women, we tend to just say, well, I'm fine, I don't need to get screened.
Right. We hear that a lot from a lot of our patients. I would say having women come in for their annual preventative screenings, we're able to pick up on early breast cancers, cervical cancers through the pap smears. So we're able to pick up on a lot of things that, you otherwise cannot feel.
And we're going to talk about those specific screenings here in just a little bit, but we should also mention too, doctor, that it's important to get those annual physicals, the blood work, and sort of the things that maybe we don't think are necessary if we're feeling great.
Correct. We're easily able to pick up on declining kidney function, changes in your liver, high cholesterol, and many other things through talking with you and seeing you once a year at least.
And absolutely, I think it's important too to kind of get that baseline. You're feeling great year to year, and then maybe there's a slight shift. The physicians know where to look. Let's talk about the importance of screenings, as you just started a little bit ago, and breast care and mammograms. Of course, women, average risk, let's talk about that, and ages for these types of exams.
Yeah, so under the age of 30, we do start pap smears at the age of 21, and we do those every 3 to 5 years. Also above the age of 30, we do pap smear, and it's paired with the HPV exam. Also, we do breast exams paired with those pap smears every 3 to 5 years. And then we start mammograms at age of 40. Unless you have a family history of breast cancer, then we can start that a bit earlier, 10 years from the diagnosis of the family member.
And keep that conversation going with your physician as well. Let's talk about colon cancer screenings. The ages have changed a little bit here in the last couple of years, but a lot of people think, oh, my word, I don't want to take this test. It's too much. But let's talk about the age that we should start screening for this. And really, it's just the prep that is kind of the problem. It just takes a little bit of an issue, but once you're through with that, the rest is easy.
Correct. We're now starting at 45 instead of 50, but I would say we've gone much better with the prep. It's much better to tolerate. You're not carrying this big gallon of liquid to chug the night before, so it is a much easier process, and we have more options other than the colonoscopy.
Absolutely. And again, talk to your doctor. Dr. Uku, I do think that this is such an important topic for many of us, many women. We're busy, we're worried about the family. Sometimes our own health care gets kind of pushed down, and especially during the lockdown, the pandemic, maybe we put those screenings off, but now is the time to make those appointments.
Correct. We would be more than happy to take care of you and talk about the things that affect your daily life so we can take a proactive approach to getting ahead of anything that could be affecting you in the future.
Dr. Jennifer Uku, primary care physician with Memorial Hermann. Thank you so much for the conversation today.
Thank you so much, Courtney.
Absolutely. For more information, you can visit memorialhermann.org/MHMG. Now we're going to send things over to Derek, who's back